So today I will be presenting for shoulder palpation, and we're going to begin with the posterior aspect of the shoulder. So first we're going to palpate for the medial border of the scapula. We will do that by standing on the opposite side of my patient and then coming in from the middle towards the medial border of the scapula. And I know I'm on it when I feel a bony prominence. So next we will go to the inferior angle of the scapula. I will move down inferiorly until I start to feel a curve, which I believe is right here, and I can confirm it with the patient putting his arm behind his back, like so. And then the inferior angle should pop right out, right about here. So here's the inferior angle of the scapula. Next we will go to the superior angle of the scapula. So from the medial border, I will go superiorly until I feel it start to curve off a little bit. And I believe I'm on it. I can confirm it by passively elevating the patient's shoulder, and I should feel a bony prominence come into my finger, and I do right here. Next, we're going to palpate both borders of the spine of the scapula. So from the medial border, I will move laterally, and when I feel a bony prominence, I know I'm on the spine of the scapula. So inferior to that, I will push up until I feel a bony border, and I know I'm on the inferior border of the spine of the scapula. And then for the superior border, it's very similar. So from the spine of the scapula, I will move superiorly and then palpate inferiorly to feel for the superior border of the spine of the scapula. So I have it oriented around here. So next I'm going to palpate for the acromial angle. So going along the spine of the scapula, I will continue until I feel a bony curve, which is right about here, and that is the acromial angle of the acromion. And if I continue moving laterally, I will begin to feel for the acromion itself. So next is the muscle belly of the supraspinatus muscle. I will palpate for that by having the patient go into scaption and then feeling along the supraspinatus fossa. I can feel tension right here, which indicates that the supraspinatus muscle is activated. So next I will palpate for the infraspinatus tendon. So for this, I'm going to have Jeff here go lie prone, so go on your stomach. So with his shoulder, so get on your elbows. So with his shoulder adducted and slightly externally rotated, I can feel for his infraspinatus tendon and insertion. And I can feel the tension right here. right here. So next I will be palpating for the lateral aspect of the shoulder, starting with the lateral edge of the acromion. So continuing on from the spine of the scapula, I will continue until I feel a bony prominence right along here, which is indicative of the lateral edge of the acromion. Continuing on, we will need to shift the chair facing towards the camera. So stand up. So continuing along for the acromial spine, we'll continue along that lateral edge of the acromion until I feel a bony prominence right about here, which indicates the acromial spine. So next up, I'm going to palpate for the orientation of the acromioclavicular joint. I will do this first by feeling for the posterior V. The posterior V being the posterior portion of the AC joint. To do that, I'm going to palpate the superior edge of the superior border of the spine of the scapula, and I'm going to continue along that superior border until I feel what feels like a V forming between the clavicle and the scapula. And to help with this, I can palpate for the superior border of the scapula. And right here, I feel the two bones merging together, and this is the posterior V of the AC joint. For the anterior V, it's very similar. I'll palpate the inferior border of his clavicle, along with continuing along that acromial spine until I palpate what feels like a little divot, and that indicates the anterior V of the AC joint. And I believe right here is where I feel for the anterior V of the AC joint. So with these two orientations, I can approximate that the AC joint is somewhere lying within this plane. Next up is the anteromedial aspect of the shoulder joint. Starting with the sternocleidomastoid muscle, to visualize this, I'll have my patient rotate his head to the contralateral side, so rotate your head to the right. And along here, I can feel the sternal portion of the sternocleidomastoid muscle running along this orientation. And then for the clavicular aspect, I can have him apply force to the ipsilateral side, and then following that, I can feel for the clavicular portion of the sternocleidomastoid muscle. For the medial end of the clavicle, continuing on from the AC joint, I can palpate my way along more medially to his sternum, and I can feel for that medial end of the clavicle. And then moving more medial, I can feel this little joint space between his sternum and the clavicle being the sternoclavicular joint. And I can confirm this by having him abduct his shoulder, and while I feel his clavicle moving, I do not feel the sternum moving. And then lastly, for the anteromedial aspect of the shoulder complex, I'm going to palpate for the infraclavicular fossa. To do this, I'll have my patient slightly flex his shoulder and abduct it, and then I will feel for what feels like a little divot within the joint, within the area. And I'm on it right here because I can feel the divot. I am in the infraclavicular fossa. And finally, for the anterolateral aspect of the shoulder complex, I will begin with the coracoid process. So, orienting myself back into the infraclavicular fossa, so orienting myself with the infraclavicular fossa, if I move slightly lateral, I will feel a bony prominence, and that is the coracoid process. From there, if I move slightly more lateral, I will feel for a space, and then the next bony prominence I should feel is the lesser tubercle of the humerus. Now that I'm on it, if I move slightly lateral, I should feel a little dip, and that is the intertubercular sulcus. Which I can feel the divot right here. And then once more, if I go lateral, I will be able to palpate for the greater tubercle of the humerus, which I can palpate right here. Next is the orientation of the glenoid cavity. And to follow that, I will once again palpate for the coracoid process, which should be about right here. And then for the lateral edge of the acromion, which I can feel behind him right here, and then essentially pinching those two landmarks together, I have the orientation of his glenoid cavity. And finally, we have two tendons that we need to palpate for. The first is the supraspinatus insertion. To do this, I will palpate for the acromial spine, and then move just inferomedial. And then I can confirm this location by having the patient place his arm behind his back once more. I feel a tightening that indicates that I am on the supraspinatus tendon. And then to palpate for the subscapularis tendon, coming back to the coracoid process, I would move slightly lateral between the lesser tubercle and the coracoid process and have him passively externally rotate. I can feel that move and the tension forming with it, so I know I'm on the subscapularis tendon. And that is palpation of the shoulder joint.